FM 91.5. The focus of this special program is on health, and we are talking about the second round of Maternal, Newborn and Child Health Week across all the local government areas of Ekiti State. And for the purpose of our native speakers, we shall be having this program in both Yoruba and English languages. Ẹ kú dédé àsìkò yìí gbogbo ẹ̀yin olùgbọ́ wa ní gbogbo ibi tí ẹ ti ń gbọ́ wa. Ẹ sì káàbọ̀ sórí àkànṣe ètò lórí ìkànnì tí a wà yìí 91.5 Ekiti FM. Àkànṣe ètò yìí náà ni a sọrí ìlera. Ilé-iṣẹ́ ètò ìlera Lábọ́dé nípìnlẹ̀ Èkìtì ń ṣe àkànṣe ètò ọlọ́sẹ̀ kan fún àwọn ìyálọ́mọ tuntun, ọmọ wẹ́wẹ́ àti àwọn ọmọdé. Orúkọ tèmi ni Olúbùkọ́lá Òjó. Àwọn àlejò mi ti wà níkàlẹ̀. I have my guests right seated here. They aren't begging around hole, and they are from the Ekiti State Primary Healthcare Development Agency. They are sitting next to me is Dr. Akin Ogunsakin. He is the Director, Community and Family Health Services. And sitting next to him is Mrs. Bolanle Olorunyomi. She is the State Nutrition Officer, Ekiti State Primary Healthcare Development Agency. You're welcome to the studio, my guest.
Thank you.
Thank you.
I will begin with you, Dr. Ogunsakin. Would you like to tell us the significance of this Maternal, Newborn and Child Health Week?
Thank you, moderator. The Maternal, Newborn and Child Health Week was actually designed to deliver a package of interventions and services that will promote improvement in maternal health and reduce child mortality. The services we are going to be rendering are services we are actually rendering in our health facilities on daily basis, but because of the coverages we are actually getting, it's not enough for us to get the desired impact. That's why we are bringing this package as a way of boosting our coverages. Thank you.
Since we are having this program in both languages, I will want Mrs. Olorunyomi to tell us, ṣé lè sọ fún wa pàtàkì ìdí tí a fi ń ṣe ọ̀sẹ̀ àwọn ìyálọ́mọ tuntun àti àwọn ọmọ ọwọ́ nípìnlẹ̀ Èkìtì.
Ẹ ṣé olóòtú. Gẹ́gẹ́ bí àwọn ọ̀gá mi ṣe sọ.
Ẹ bá wa gbóhùn sókè.
Okay, gẹ́gẹ́ bí àwọn ọ̀gá mi ṣe sọ ní èdè òyìnbó. Ọ̀sẹ̀ yìí ó wà fún àwọn ọmọ wẹ́wẹ́ láti ọmọ òòjọ́ títí dé ọmọ tí ó kù díẹ̀ kó pé ọdún 5 àti àwọn aláboyún wa. Tá bá wo àwọn health indices wa, a rí wípé àwọn ọmọ tó ń kú àti àwọn aláboyún tó ń kú ó sì pọ̀ ju bó ṣe yẹ lọ. Ìdí nìyí tí a ṣe gbé ètò yìí kalẹ̀ wípé kí àwọn aláboyún àti àwọn ọmọ wẹ́wẹ́ wa kán lè ní àǹfààní sí àwọn ètò ìlera tí a ní fún wọn nínú ọ̀sẹ̀ tí a ń pè ní Maternal, Newborn and Child Health Week yìí. Ẹ ṣé. Arábìnrin
Olorunyomi, láti ìgbà wo ni ẹ ti bẹ̀rẹ̀ ètò yìí àti wípé kí ni àwọn ipa tí ètò yìí ti ní láti ìgbà tí ẹ ti bẹ̀rẹ̀?
Ètò Maternal, Newborn and Child Health Week yìí tí ó ti bẹ̀rẹ̀ báyìí ó ti lé ní ọdún 10 ní orílẹ̀-èdè Nàìjíríà.
Nípìnlẹ̀ Èkìtì?
Ní ìpínlẹ̀ Èkìtì, bẹ́ẹ̀ ni ó ti tó bẹ́ẹ̀.
Ó ti lé ní ọdún 10.
Bẹ́ẹ̀ ni.
Kí ni àwọn ipa tó ti ní láti ìgbà tí ẹ ti bẹ̀rẹ̀ sí ṣètò náà?
Láti ìgbà tí a ti bẹ̀rẹ̀, a rí wípé nínú ètò yìí a ní àwọn health services, àwọn ètò ìlera fún àwọn ọmọ wẹ́wẹ́ àti àwọn aláboyún. Ṣé mọ̀ pé tí a kò bá ṣe ọ̀sẹ̀ yìí, ó ṣeé ṣe kí a má ní àǹfààní láti lè rí àwọn ọmọ yẹn tàbí àwọn aláboyún yẹn. So tá bá ti bẹ̀rẹ̀ ọ̀sẹ̀ yìí, irú àwọn ọmọ wẹ́wẹ́, abẹ́rẹ́ àjẹsára wà fún wọn, vitamin A supplementation wà fún wọn, oògùn aràn wà fún wọn. So wọ́n máa ní àǹfààní sí àwọn ètò ìlera yìí. Ìdí nìyẹn tí a ṣe máa ń ṣe ètò ìlera yìí fún àwọn aláboyún àti àwọn ọmọ wẹ́wẹ́.
Okay, thank you very much. Dr. Ogunsakin, how often does this program come up?
It's actually a biannual program. We do it twice in a year, and it takes 5 days during each implementation. And there must be at least minimum of 6 months between implementations. Thank you.
You mentioned that it was observed that high mortality rate is due to people not coming to health facilities. Is this only the reason why we have high mortality rates, especially in Ekiti State among our pregnant women?
Yes, most of the health conditions we're actually dealing with, they are preventable diseases and health conditions. If our people are actually assessing our health care as our when due, they have the benefit of actually preventing these unnecessary deaths. This week we are actually executing is actually a way of actually boosting the coverage of what we are expected to have seen in our health facility.
But you will say confidently that it's a continuous one, because when we're talking about high mortality rates, it goes beyond a week-long program.
Of course, as I've told you, there's nothing special about the week, about things there are things we are doing on daily basis in our health facilities. It's because we are not actually seeing enough people accessing this care. Okay. We are using this week as a means of sensitization to deliver high impact services to ensure that we bridge the gap of what we are expected to have actually delivered in our health facility.
When is the commencement date of this program?
The program starts next week, Monday, 5th of December, 2022.
Of December 2022. Okay. Mrs. Olorunyomi, we already know from the name given the program that is for some certain people, certain age group of people. Would you lay a kind of emphasis on those who you are actually expecting to be at the program?
Okay, thank you. From the name already, Maternal, Newborn and Child Health Week, we are expecting the pregnant women. We are also expecting children from day old to 59 months. That means that 59 months means a child it remains 1 month for the child to be 5 years old. So they are under 5. So those are the caliber of people we are expecting at this program. But actually, the packages we have for the program also extends to the men.
Okay, we'll get to that, Mrs. Olorunyomi.
Thank you.
Would you like to, this information you just passed, would you like to say it in our native language? Share the Soni Edi Abinibi. Àwọn wo ni ẹ̀ ń retí níbi ètò ọlọ́sẹ̀ kan yìí?
Okay, ètò ọlọ́sẹ̀ kan tí a ní yìí, ó wà fún àwọn aláboyún wa àti àwọn ọmọ wẹ́wẹ́ bẹ̀rẹ̀ láti ọmọ òòjọ́ títí di ọmọ
ọmọdún márùn-ún.
ọmọ tó bá bẹ́ẹ̀ ni ọmọ ọdún márùn-ún dín ní oṣù kan. So à ń pè wọ́n ní àwọn ọmọ tí wọn kò tí ì pé ọdún márùn-ún, àwọn tí ètò yìí tó wà fún nìyẹn.
Ẹ ṣeun arábìnrin wa, do you have activities lined up for this week-long program?
Yes, we have activities lined up already. We have started our training of the health workers. Then we have the social mobilization committee meeting, which we also hold today. We also have community dialogues at the local government level in all the LGA. We also have our town announcers who will be announcing, telling the people the importance of the program. So, but the implementation starts mainly on Monday, next week Monday till Friday. We also have jingles, hearing of jingles on radio.
Just to create
awareness.
To sensitize people.
Yes, for people to know that something will be happening in Ekiti State.
Okay.
Thank you.
Thank you very much. Dr. Ogunsakin, can you mention some of the interventions that will be assessed during the week-long program?
Thank you, moderator. As part of services we'll be rendering within this 1 week program, immunization activity that includes COVID-19 vaccination, then the scheduled immunization, we'll be giving vitamin A supplementation, we'll be giving our children deworming tablets, we'll be screening children for malnutrition, and children actually have the opportunity of actually getting their birth registered, and we are going to be offering malaria prevention strategies like giving tablets to pregnant women in order to prevent them from having malaria. Thank you. Dr.
Ogunsakin, I want you to be explicit on the immunization activities. I know they take short intervals. Sometimes it could be long intervals before you give immunizations. Yes. So what particular immunization are you giving children during the program?
All scheduled vaccines are actually available during this program. All from oral poliovirus vaccine, penta vaccine, vaccine against yellow fever, vaccine against diarrhea disease like Rota, that one we have just introduced.
Okay, Rota 2 will be involved.
Yes, it will be available.
Will be available.
Yes,
Okay.
vaccine against meningitis.
Okay.
And yellow fever. We have all these vaccines available.
Let's digress a little. Talking about Rota, it seems strange. It seems it was just newly introduced to the immunization routine in Nigeria, in Ekiti as well. Can you talk about it so that people could actually be aware?
Thank you. One of the most common causes of death in children is diarrhea diseases. The commonest cause of these diarrhea diseases in children is virus, and the virus that is actually the most common among the viruses is what we call rotavirus. So the rationale of actually introducing this vaccine in Nigeria is to ensure that this unnecessary death coming as a result of diarrhea disease can be prevented.
Are you correcting the? I'm sorry to cut in now. Are you correcting the notion that children between 0 to about 3 years, 4 years usually have stooling at intervals, and is not due to teething, because that is what mothers usually believe, that when the child is bringing out a new set of teeth, he stools, he shows signs of diarrhea, and the rest of that.
Teething does not actually cause diarrhea disease. It's a misconception. Whenever children are actually silly, there must be an underlying cause to it. Definitely, teething is not one of them.
Dr. Ogunsakin, you oblige etumabawa sọ ní èdè abínibí àwọn nǹkan tí àwọn ènìyàn máa jàǹfààní, àwọn ètò ìlera tí àwọn ènìyàn yóò jàǹfààní láàárín ọ̀sẹ̀ kan tí ẹ fẹ́ ṣe ètò yìí, kí ni káwọn èèyàn máa retí?
Ní àárín ọ̀sẹ̀ kan yìí, àwọn nǹkan tá a máa fún àwọn ìyá ọlọ́mọ wa àtàwọn ọmọ wọn òun ni abẹ́rẹ́ àjẹsára bíi COVID-19. Àwọn ọkùnrin náà láǹfààní àti jàǹfààní eléyìí o. A máa fún wọn ní abẹ́rẹ́ against rọpárọsẹ̀, abẹ́rẹ́ tẹ́ pé tá a dènà yìkíyìkí, abẹ́rẹ́ fún àìsàn ìgbẹ́ gbuuru, abẹ́rẹ́ àjẹsára fún ti lọ́rùn. Then a tún láǹfààní náà láti máa fún ìyá ọlọ́mọ ní àwọn nǹkan fètò sọ́mọ bíbí àti èròjà láti máa fún wọn láti make sure pé wọ́n ní okun lára bí èròjà bí vitamins. Then àtúmọ̀ àwọn tó lóyún lára wọn aláǹfààní àti máa fún wọn ní oògùn tí ò ní jẹ́ kán ní àrùn ẹ̀bà nínú oyún. Ẹ ṣé olóòtú. Ẹ
ṣeun púpọ̀. Arábìnrin Olorunyomi, níbo ni káwọn èèyàn ti máa gbé àwọn ọmọ wọn wá àti àwọn aláboyún, níbo ni kán ti wá jàǹfààní ètò yìí?
Ẹ ṣé olóòtú.
Àwọn oríkò wo?
Ní gbogbo ìjọba ìbílẹ̀ 24 tó wà ní ìpínlẹ̀ Ekiti ni ètò yìí ti máa wáyé. A dẹ̀ ní àwọn ilé ètò ìlera alábọ́dé tá à ń pè ní primary health care centers ní gbogbo àwọn ìjọba ìbílẹ̀ yìí. So wọ́n lè wá sí àwọn
oríkò ètò ìlera alábọ́dé tó wà ní agbègbè wọn.
Bẹ́ẹ̀ ni, bákan náà àwọn elétò ìlera wa wọ́n máa lọ sí àwọn ilé ìwé primary school láti fún àwọn ọmọ yẹn ní vitamin A tá a sọ yẹn àti oògùn àrùn àti àwọn bí abẹ́rẹ́ àjẹsára.
Ṣé àwọn elétò ìlera ṣé wọ́n máa lọ láti ojúlé dé ojúlé bí wọ́n ṣe máa ń ṣe láwọn tó máa fẹ́ fún àwọn ọmọ ní abẹ́rẹ́ àjẹsára?
Ó ṣeé ṣe kí wọ́n lọ sí ojúlé dé ojúlé, ìyẹn tí àwọn ọmọdé tàbí aláboyún bá wà ní irú ilé bẹ́ẹ̀.
Àwọn ilé ìwé kan wà tó jẹ́ pé nígbà tí àwọn elétò ìlera alábọ́dé tí a gbọ́ wípé wọn kì í gba àwọn elétò ìlera alábọ́dé láàyè láti fún àwọn ọmọ wọn ní abẹ́rẹ́ àjẹsára ni tàbí àtọ́lá tàbí ohunkóhun tí àwọn elétò ìlera bá gbé wá, kí ni ń ṣe nípa àwọn ilé ìwé yìí, àti wípé báwo la ṣe lè dènà irú nǹkan bí eléyìí láti má ṣe já àwọn ọmọ wa nítàn mọ́ àti jàǹfààní?
Ní ọ̀pọ̀lọpọ̀ ìgbà ohun tó máa ń fa irú àwọn nǹkan bí eléyìí ni wípé tí wọn kò bá ti mọ̀ ṣáájú pé irú ètò bẹ́ẹ̀ yẹn máa wáyé, ó ṣeé ṣe kí wọ́n má gba àwọn oníṣẹ́ ètò ìlera láyè láti wọlé sí ilé ìwé wọn. Ṣùgbọ́n a ti gbìyànjú láti rí wípé a ti kọ̀wé ránṣẹ́ ṣáájú pé kán lè mọ̀ wípé àwọn elétò ìlera ń bọ̀ kán jọ̀wọ́ kán gbà wọ́n láyè láti ṣe ohun tí wọ́n fẹ́ ṣe.
Okay, thank you very much. I will still want you to say that in English. The designated centers for this program. Okay,
in all the 16 local governments in Ekiti State, we have our primary healthcare centers where these services can be accessed. Then we also have we call them the mobile team, who will be going to schools to give these children immunization, vitamin supplementation, and deworming tablets. So those are the designated places where these services can be accessed. Thank you.
Thank you very much. How is your relationship, or how are you synergizing with, since this program is taking place in all the local government areas and rural areas as well, how are you synergizing with heads of the monarchs, the traditional chiefs, and heads of each quarter in every local government area to make sure that this program achieves its success? Okay,
thank you. In every local government, we have the health committees. We also have, at the state level, we also have the social mobilization committee, and we have been trying to do advocacy visits to them. Then presently, right now, is social mobilization committee meeting has started right now, where we have all the stakeholders, the yalogers, the traditional leaders, the community leaders, who are part of that committee. So they are aware that this program will be taking place.
Okay, thank you very much. This is Ekiti FM 91.5, and it's a special program which focuses health. We're talking about the Health Week, Maternal and Newborn Health Week in Ekiti State. If you want to join in the program, I have people from Ekiti, guests from Ekiti State Healthcare Development Agency in the studio, and they have been sensitizing us on when and how the program will take place. But if you still have one or two questions to ask, you're free to do that. The studio line is opened, and the line to call is 0806 522 6145. Once again, the line to call is 0806 522 6145. Ẹ̀yin èèyàn wa tí ẹ bá ń gbọ́ wa nílé, orí àkànṣe ètò ni a wà nílé iṣẹ́ rédíò ìpínlẹ̀ Èkìtì 91.5 FM. À ń sọ̀rọ̀ lórí ètò ìlera fún àwọn aláboyún, ọmọ tuntun àti àwọn ọmọdé wa. Àwọn àlejò sì wà nílé agbára níyìn láti iléeṣẹ́ ètò ìlera alábọ́dé ti ìpínlẹ̀ Èkìtì. Tí ó bá ní ohun tí ó ń ru yín lójú tàbí ìbéèrè tí ẹ fẹ́ bi wọ́n lórí ètò ọlọ́sẹ̀ kan yìí, ẹ lè pè sórí ìlà 0806 522 6145 láti lè béèrè ìbéèrè lọ́wọ́ wọn fún kó lè yé yín dáadáa ní gbogbo ọ̀nà tí ẹ ó gbé gbà. Ẹ ṣé púpọ̀. Dr. Ogunsakin, I'm back to you. Since this program started in Ekiti State, how would you say people's responses have been?
Thank you, moderator. The people have actually been responding very, very well, but the truth of the matter is that they could respond better. For example, during our last exercise, the one we did in June, the coverage that we recorded averagely was about 88%. So our target is to ensure that every eligible mothers and children are able to access all these cares we are offering them. Thank you.
Apart from this program that is in place now, that you'll be going from house to house and you expect people to bring their children and themselves down, how are people being, attending health facilities, primary health facilities in their localities? What would you say the body language of people to having health facilities around, and they going there to access Medicare?
The truth of the matter is that it's simply because they are not actually coming as they ought to actually be coming. That's why this kind of program is actually coming up. The health-seeking behavior of our people in Ekiti State is not particularly good enough. So we are soliciting. In fact, it's one of the things we advocate during this program, by sensitizing them that there is a need for them to patronize a facility within their community, so that these routine services we are rendering is going to be sustained, because this kind of intervention program cannot last forever. Thank you.
Because of the importance of the question, significance of the question I just asked, I would still want you to say it in Yoruba. Ìhà wo ni àwọn ènìyàn kọ sí gbígbé ara wọn, ọmọ wọn tàbí ẹbí wọn lọ sí ilé-iṣẹ́ ìwòsàn ètò ìlera alábọ́dé ní gbogbo agbègbè wọn nípínlẹ̀ Èkìtì? Gbogbo ìjọba ìbílẹ̀ láti ní àwọn ètò ìlera alábọ́dé. Ṣùgbọ́n báwo làwọn ènìyàn ṣe ń ṣe sí, kí ni ìhà tí wọ́n kọ sí? Arábìnrin ẹ má bínú sí mi, Olorunyomi, ṣe lè dábàá wa dáhùn béèrè yẹn.
Gẹ́gẹ́ bí wọ́n ṣe sọ, àwọn ènìyàn wọn kì í fi bẹ́ẹ̀ fi gbogbo ara lọ sí àwọn ilé ìwòsàn yìí. Òun náà la ṣe ń rọ̀ wọ́n wípé kí wọ́n wá gba ẹ̀tọ́ wọn, torí wípé ẹ̀tọ́ wọn ni. Àwọn àwọn ètò ìlera yẹn wà ń bẹ̀ àwọn dẹ̀ ló ní so la ṣe ń rọ̀ wọ́n wípé kí wọ́n wá sí àwọn ilé ètò ìlera alábọ́dé yìí láti wá gba ohun tó tọ́ sí wọn torí àwọn òṣìṣẹ́ wà ń bẹ̀ ohun tí wọ́n nílò náà ó wà níbẹ̀ so a rọ̀ wọ́n wípé kí wọ́n wá kán jẹ́ kí ètò ìlera ara wọn kó ká wọn lára.
ẹ ṣeun púpọ̀ arábìnrin Olorunyomi. Dókítà Ogunsakin, èló ni kí àwọn èèyàn máa mú èló ni kán mú lọ́wọ́ tí wọ́n bá ti ń bọ̀? What's the cost implication of the program?
ọ̀fẹ́ ni o kọ́bọ̀ wọn nígbà lọ́wọ́ wọn gbogbo àwọn ètò ìlera yìí ó wà ń bẹ̀ fún wọn lọ́fẹ̀ẹ́ kódà nígbà tá a ní kán máa wá déédéé láti máa lọ sí àwọn ètò ìlera alábọ́dé wọ̀nyí àwọn ètò yìí náà wà ń bẹ̀ náà fún wọn lọ́fẹ̀ẹ́ kì í ṣe ìgbà yìí nìkan kọ́ ló wà fún wọn lọ́fẹ̀ẹ́ nìkan gbogbo ìgbà ló wà fún wọn lọ́fẹ̀ẹ́. ẹ ṣé olóòtú.
Àwọn àti gbọ́ awuyewuye láwọn ìgbà kan wípé táwọn èèyàn bá délé ìwòsàn ìjọba alábọ́dé o wọ́n á ní kò sí ọṣẹ ìfọwọ́ o kò sí ike tá a fi bomi o kò sí àwọn èròjà o wípé kán máa dá owó kán máa ṣé èyí tọ́nà?
Kò tọ́nà báyìí mo dẹ̀ nígbàgbọ́ pé irú ẹ̀ ò ṣẹlẹ̀ mọ́ because ètò kan wà tí ìjọba àpapọ̀ pẹ̀lú ìjọba Ekiti state tán jọ papọ̀ tán gbé kalẹ̀ tán pè ní basic care provision fund jẹ́ pé oṣooṣù náà ń fowó kalẹ̀ láti make sure pé gbogbo nǹkan tí ó dàbí kan wọ́n máa need ní àwọn ètò ìlera yìí ni wọ́n fi kalẹ̀ tó yẹ pé so ọ̀rọ̀ pé wọ́n rówó rọṣẹ́ wọ́n rówó ṣe kankan irú ẹ̀ ò ṣẹlẹ̀ mọ́ at least health center kọ̀ọ̀kan ní wọ́ọ̀dù kọ̀ọ̀kan níjọba ń gbìyànjú tó yẹ pé wọ́n fowó sí lóṣooṣù láti make sure pé wọ́n lè fi ojú tó gbogbo àwọn nǹkan kéékèèké tó lè máa mú wọn láti máa béèrè nǹkan lọ́wọ́ àwọn tó ń wá síbẹ̀ láti wá gba ètò ìlera. ẹ ṣé olóòtú.
ẹ ṣeun púpọ̀ dókítà wa. Since it's a family week, it's meant to promote this kind of bond, health, especially health-wise, among family members. Men being the head of the home, I noticed that they have not really been carried along in any of this program. It's always about women, pregnant women, lactating mothers, and the rest of that. It's always centered around mothers. Why are men not carried along in any of these interventions? Would you want to answer, Dr. Ogunsakin? You being a man.
The truth of the matter is that we came up with this kind of program because we know that it's pregnant women and children, particularly under 5, that are actually having high morbidity and mortality. So they are the target. But that does not really mean that we are not actually carrying men along in mobilizing their family member to access all these cares. So the government and donor agencies are actually trying to put their money where they are going to realize maximum impact when it comes to the issue of health. Thank you.
And for this program that we're having, isn't there any place where men could fit into?
There is. As I've told you, COVID-19 vaccination is part of the program. It's available to all age groups. So men can actually access this. Thank you.
Ẹ bá wa sọ ní èdè abínibí. A rí pé àwọn ọkùnrin wa, àwọn baálé wa tó ń jẹ́ olórí nínú ìdílé, wọn kì í sábà bójútó ọ̀rọ̀ tiwọn náà. Gbogbo nǹkan tá máa ń sọ ni pé ìyá lọ́mọ, abiyamọ, ọmọ wẹ́wẹ́ àti gbogbo gẹ́gẹ́ bí baálé ilé àti pé ètò yìí wà láti tún mú ìrẹ́pọ̀ tó dánmọ́rán wà láàrin ẹbí pàápàá tó ní ṣe pẹ̀lú ìlera. Kí ló dé tí àwọn ọkùnrin wọ̀ ń jẹ àǹfààní tó péye nínú irú àwọn ètò wọ̀nyí?
Kì í ṣe pé àfẹ́ kan jẹ àǹfààní. Nǹkan tó ṣẹlẹ̀ ní pé àwọn àkọsílẹ̀ tá a ní ó fi yé wa ní pé àwọn tó ń kú jù nípasẹ̀ àìsàn àwọn ni aboyún obìnrin àtàwọn ọmọ wẹ́wẹ́ náà jọmọ ọdún 5 sísàlẹ̀. So àwọn ikú yìí la fẹ́ really prevent pé kó má máa ṣẹlẹ̀ mọ́. òun nílùú target náà fi síbẹ̀ yẹn omi pé a kì í pe àwọn ọkùnrin àwọn olórí ilé ìwé ìgbà tá a bá ń ṣètò gbogbo àwọn kan tá à ń ṣe yìí a máa ń lọ́nà tá a fa mission kan jọ kan bá a sọ fún àwọn ìyàwó wọn àtàwọn ọmọ wọn kán lè make sure pé wọ́n láǹfààní láti gba gbogbo nǹkan tí a gbé síta tá a máa fọ́ fún wọn. ìyẹn ò wá mí pé àwọn ọkùnrin ò ní àǹfààní kankan tá a rí lélẹ́yìí náà o. mo ṣe sọ COVID-19 ọkùnrin obìnrin àgbàlagbà gbogbo ló láǹfààní àti jàǹfààní láti lọ sí àti ìdẹ̀wọ́n dẹ̀ lè screen HIV fún àwọn aláboyún then family planning gbogbo ẹ̀ ó wà síbẹ̀ fún gbogbo àwọn èèyàn tó wá fẹ́ access.
Dr. Ogunsakin, do you have any special concern for people in orphanages, for children in orphanages and those who are living with one disability or the other?
all
There
these
are
stage
provisions for them.
yes, definitely. As the health educator said earlier, this program is actually meant for the vulnerable groups, and these people suffering from disability and those in orphanages, they actually fall under these particular categories. All these places are going to be visited, and definitely they will have access to access all this care.
Okay.
Thank you.
If people have comments or contributions, or they want to make their complaints, is there a particular number, a devoted number that they can call?
Yes, as we have said earlier, this program is actually decentralized. It's taking place in all the 16 local governments of the state, and there is a team in each local government that is actually overseeing the activity. So there's an health educator, and there's a PEAC or health secretary at this all the local governments that people have access to if they have any complaint.
Thank you very, very much for that explanation. It's been about 45 minutes since we've been discussing, 30 minutes rather, since we've been having this program focused on health. Okay, let's take a short break. I'll be right back after now.
ló lè ṣẹ́gun àrùn gbogbo ẹ̀fọn tó gbòòrò àtúnlọ́wọ́ àwọn tó rẹ̀rọ kẹ́kùn lè gbà kó sàfún tókò cleanliness is essential immortalize your potential understand the times and your initial. mọ́tótó borí àrùn mọ́lẹ̀ láṣẹ ní ká ṣe lọ́jú àyíká àlàbòyún máa ń bá bẹ́ẹ̀ aláboyún ẹ̀ fọwọ́ wọ́wọ́ ẹ jẹ́ ká ṣètọ́jú àyíká àlàbòyún.
If you really want to live long, you have to stay strong and you have to abide by the rules. Of course, you have to abide by the rules. That is why we're having this program this morning. It's a special one. And the port is still open. The line is still open. 0806-522-6145 will be the studio line to call in case you have questions or you have something that is boggling your mind. You may want to share it with our guest in the studio right here. I would want to ask you, Dr. Ogunsakin, let's digress a little bit. Talking about COVID-19, people no longer use their face mask. People no longer observe all the measures put in place by government and health workers. Why is this so? Is it that we no longer have COVID-19 around here again? Has it been phased out?
There is COVID-19. The only thing is that the prevalence has actually reduced drastically, and the benefit of people getting vaccines is actually coming up. So the transmittability between individuals has actually very reduced, and that's why we are advocating that people should continue to take this vaccine so as to ensure there is no sudden surge in the prevalence that we are currently having.
So you can say confidently that in Ekiti State we have been able to flatten the curve.
Yes.
Okay.
We are doing very, very well. I still continue to encourage our people to let us continue, to sustain this tempo by actually coming out to assess this COVID-19 vaccination. And this program actually offered them another opportunity to assess the COVID-19, even though, as I've told you, all these things are actually available in our health facility on daily basis.
So one can walk in anytime and
definitely
have the test done?
No, it's not the test, it's the vaccination.
It's the vaccination. What about the testing?
The testing is actually based on those people that are actually suspected to be having the disease, so as to confirm the diagnosis.
Okay, what about HIV screening?
HIV screening.
How prevalent is it in Ekiti as we speak?
The prevalence in Ekiti is about 0.8%.
Drastically low.
Yes, the truth of the matter is that we have a very good HIV program in Ekiti State. And a lot of people who are having the COVID, who are having HIV are actually placed on drugs, which is the most important strategy.
And coincidentally, today is World AIDS Day.
Thank you for remembering.
Okay, so I think we have to wrap it up on the program now. But before we go, I still wanted to advise our pregnant women, our fathers, pregnant women, because the role of father, like I said earlier, cannot be underestimated, because they want to give permission to their wives to take their children out for whatever program they want to. So give advice to fathers, mothers, and of course, on how to access all of these programs, these beautiful ones that you have lined up for the week. Dr. Ogunsakin.
Okay, I will admonish on all fathers to please help us mobilize their wives and children to visit all the health facilities where all these services are available, to access them. It's free of charge. And even after this program, they should continue to access all this care because they are all available at all times in our health facility. A lot of money has actually been invested in this program, so they should not allow it to go down the drain.
Thank you very much. And when will the next round be?
It can't be less than 6 months.
6 months.
Yes, that will be next year.
Okay. From you, Mrs. Olorunyomi. Yes. Your advice, yes?
Okay, my advice is that the fathers should encourage their wives to access these health facilities and also take the children to the facilities to ensure that they are well taken care of, because health is wealth.
Sure, health is wealth. Would you want to say it in Yoruba as well?
Ìlera ni ọrọ̀.
The advice. Ìmọ̀ràn yín fáwọn
Okay, ìmọ̀ràn mi fún àwọn bàbá wa ni pé kí wọ́n gbárùkù ti àwọn ìyàwó wọn láti lè rí wípé wọ́n lọ sí àwọn ilé ìwòsàn alábọ́dé yìí, àti pé kí wọ́n jẹ́ kí àwọn ọmọ wọn náà kí wọ́n lọ láti lè rí wípé wọ́n ní ìtọ́jú tó péye, torí wípé ìlera ni ọrọ̀.
Ìlera lọ́rọ̀, ẹ lè sọ bẹ́ẹ̀ lẹ́ǹkan sí. Ẹ ṣeun púpọ̀ ẹ̀yin àlejò mi tí ẹ ti wá láti la àwọn ènìyàn wa lọ́yẹ̀ lórí ètò ìlera fún àwọn ìyálọ́mọ, ọmọ tuntun àti àwọn ọmọdé wa láàrin oṣù kan.
ọjọ́ kan
bẹ́ẹ̀ ni ọdún márùn-ún ó dín oṣù kan. That is
0 to
59 months. Ẹ ṣeun púpọ̀ tí ẹ ti là wá lọ́yẹ̀. We thank you for sensitizing us and for the awareness created this morning on the program. And we do hope that it will be a great success, judging from what you have said so far.
Thank you.
We wish you success. We wish you luck.
Thank you very much.
Thank you for being there to listen to the program, and I hope you yielded to the clarion call. You take to the advice of taking yourself and your children to any health facilities and avail them the opportunity to be given whatever it has been lined up for them during this Maternal, Newborn and Child Week in Ekiti State. This program is proudly sponsored by Ekiti State Healthcare Development Agency. Olubukola Ojo is my name on behalf of the producer of the program, Tunji Saliu. I'm wishing you a very splendid day. Bye.